Root canal. That word alone can bring fear to the minds of many people, mostly due to the unknown nature of the treatment. By the end of this film, we hope you'll have the information you need to gently explain the nature of root canal therapy to the patient and work with your doctor to provide it in an environment that is as healing for the patient as your treatment is. When you provide endodontic care, endo meaning inside, and dontic meaning tooth, you participate in the prevention, the diagnosis, and the treatment of diseases of the pulpal tissues of the teeth. Root canal treatment, also known as endodontic or endotherapy, involves the removal of diseased pulp tissues. The shaping of the canals and the pulp spaces for proper filling or obturation. The sterilization and the drying of the pulp spaces. And finally, their filling with special sealers that prevent the recurrence of disease. Don't just call it a root canal. Root canals are something everybody has. It's called root canal therapy or root canal treatment. Patients that elect to save their teeth with root canal therapy have obviously been sold on the treatment. They know that saving a tooth is more economical in the long run. Just as neighbor books on a shelf may collapse into the space of removed books, so do teeth drift into the spaces created where other teeth once were. The importance of root canal therapy cannot be overemphasized. If a patient saves her teeth, replacement bridges and partials may not be needed. Her smile stays full and radiant, and the teeth work in harmony, with no drifting and the related jaw joint injuries that can ensue. The diagnosis of pulpal disease follows a number of possible causes. From trauma to deep decay to severe periodontal disease, the diagnostic process can be quite complex. A tooth's inflammation may be reversible, and others may require treatment. A fractured root may eliminate the opportunity for root canal therapy completely, and yet a tooth totally knocked out of its socket and with marginal hope for healing may be saved using root canal therapy. Successful endotherapy involves many things. The tooth must be otherwise healthy and free of periodontal disease. It must be restorable and contribute to the patient's overall dental health. Your doctor's treatment must be sterile and exact, eliminating all internal diseases and replacing it with a sealed, clean inner space. And finally, the tooth must be properly cared for afterward, being covered with the needed restorative support like a crown. Scheduled follow-up X-ray exams are also extremely important to monitor healing. In endodontics, your role as the dental assistant is important. Aside from reassuring the patient, efficient treatment can't be provided unless everything needed for care is present. The room, the patient, even yourself, all must be ready for the doctor's attention when he or she is available. And once the treatment begins, the degree of your participation varies with your doctor's habits. You may be asked to expose X-rays at different stages of the procedure, to select, measure, and set the file lengths. And you may even perform and log some of the pulp testing procedures. When the treatment is complete, attention to the next patient begins as you properly prepare the treatment room and instruments for their protection. Teeth respond well to 3 simple tests: temperature, electrical stimulation, and percussion or tapping. The outcome of each of these is compared, resulting in the doctor's final diagnosis and decision regarding care. Temperature tests use ice and cold sprays and heated gutta percha, a special type of rubber used in dentistry. Electrical testing is done using a state-of-the-art pulp tester and low-level currents. Percussion involves biting pressure and lightly tapping on the suspect tooth with a hard object, like the handle of a dental mirror. Teeth conduct the applied electrical stimulus of a pulp test in various ways, depending on the tooth's size, the number of roots, but especially on its health status. Naturally, a tooth with a dead nerve doesn't conduct an impulse at all. Tests are done using increasing voltages on the suspect teeth until the patient senses a tingle. Make sure that the tester is set to 0 before beginning and stay away from any metal fillings. Toothpaste makes an excellent conductor paste. The required current level for the first sensation is noted. Healthy teeth on the opposite side are then tested as a normal comparison. The doctor uses the results from the electrical pulp tests in forming a final diagnosis. Cold tests are especially helpful. Generally, teeth that hurt when they're exposed to cold but stop quickly when warmed up usually have reversible inflammation. They can heal on their own. Prolonged or severe pain to cold likely means that root canal therapy is needed. If a cold spray is not available, ice can be used by partially filling an empty anesthetic cartridge with water and freezing it. Applied heat is the least useful test, but it may be used to determine if an abscess is present. Heated gutta percha should elicit a response. If not, the nerve may be dead. Be sure to coat the test tooth with Vaseline first to prevent the gutta percha from sticking to the tooth. Again, the results are all logged to aid the doctor in his diagnosis. If the area around the root tip is inflamed, tapping on the tooth triggers a brief but very notable response. An inflamed tooth's root tip may be very delicate, much like a splinter underneath the skin, so tapping pushes the tooth into the inflamed area. A reaction by the patient is proof of the tooth's compromised state. Generally, healthy teeth are tapped first, so as to not alarm the patient. Suspect teeth follow, and then some more healthy teeth as comparison. There are a few other tests the doctor may use to make his final diagnosis. Transillumination, using a very bright light, usually the handpiece's fiber optic light or a composite curing light, helps identify cracks or any pulpal injuries. Also, gently rocking the tooth or depressing it into its socket can help identify degeneration in the bone of the tooth socket, which can also be an indicator of disease. Finally, and as a very last resort, a test cavity may be needed. Here, the doctor carefully drills into the cavity without any anesthesia to determine the pulp's status. This test is reserved until all others have failed to render a dependable diagnosis. Root canal therapy may be unpredictable. Every tooth is unique and has its own degree of difficulty, so the process is not 100% totally effective, especially since the degree of disease affects treatment outcome as well. More importantly, a tooth's shape within determines the doctor's ability to access all of the nooks and crannies and render the inside clean, sterile, and sealed from recurrence of disease. Lots of details must be attended to. Root canal therapy is unique in many ways to other dental treatments. However, most dental patients never experience a root canal, and others only once or twice in their lifetimes.